Ok. Espera, yo ahora tarde. Nosotros
Recording in progress.
There we go.
I'm gonna pour this on your. If we could pour this on your head would be.
Good. Let's do it.
Hey everyone, welcome to the Skin Booster Bootcamp. We'll get started in just a minute. We're just letting a couple more people hop on. But yeah, we'll get started real soon.
Hi everyone, good morning, afternoon.
Good afternoon.
Chris, can you see the slides?
Yes. Yes.
Okay. Can you see me?
Yep.
You can see me?
Yeah.
Okay. But we can't, you can slide through. Okay, I think we've got it.
Okay, great. Well, welcome everyone to the Skin Booster Bootcamp. I'm super excited to have you guys here and go over, our product portfolio, but also show you treatments and how to use the skin boosters as we get asked these questions a lot. Super excited to have Laura Rackers on the call today, and she will be presenting. This is her baby. All Beauty Global is one of her brands. So let me give you a little background on Laura. She's a dynamic entrepreneur, educator, and a beauty industry leader in the medical and regenerative side of the business. She's a trailblazer in her career. She opened her first med spas in the central Midwest of the United States.
Okay, over here, guys. Yeah, you all finished with that, please?
She has a passion for empowering professionals through innovation, education, and results-driven strategies. Laura, are we able to mute everyone?
Yeah, that's what we're trying to do.
If you ever come out, you don't need the camp. Been out here a bunch of times. If you look, you can't do nothing. Right, you got all the equipment.
Can you move the mesh?
Well, Levi asked me, say, listen, if you want to come use the camp, whatever, you take it easy.
Sorry, guys.
Friend to friend.
If everybody could mute themselves, pretty please.
Dustin's already told him no. He can't.
So as the founder, formulator, and the CEO of All Beauty Aesthetics and All Beauty Global, and a driving force of the national sales director behind Whisper Med, Laura blends her clinical expertise with a deep understanding of aesthetics, product formulations, practice development, and a passion for advanced aesthetic education to bring the best of those she serves. With over 25 years of experience in advanced aesthetics, skincare, regenerative therapies, and Korean European techniques, Laura has trained and mentored countless practitioners across the country and even globally. She is known for her heart for others, hands-on approach, high energy presentations, and her practical insights that help elevate both individual providers and full-scale practices. Laura's mission is clear: to help professionals deliver transformative results while building profitable, sustainable businesses. Her sessions are packed with value, inspiration, and immediately actionable takeaways. And that's what we're here to show you today. This makes her a sought after speaker in the wellness industry. So please welcome Laura Rackers.
Thank you so much, everybody. And thank you so much, Chris, for the warm welcome. And everybody, if you don't mind, we're having trouble muting everyone. So if you could please make sure that you're muted, that would be lovely. So if you will just take just a second to make sure that you are muted, I would greatly, greatly appreciate it. Again, Chris, thank you so much. And thank you for everyone that is attending the webinar tonight. I want to introduce Chris. Chris is my business partner. We worked together in another endeavor, and he is a sub-distributor. He has been in the industry for 16 years in the management of aesthetic industry. He and his team are incredible. I have the opportunity to work with them day in and day out, and they truly strive to connect clinics and practices with the best in technology to provide superior results to their own patients. So thank you very much, Chris. Okay.
And one thing I just wanted to note really quick, there is a chat function here. So if you guys have any questions during the call, feel free to, put those questions into the chat box so that we can address those at the end of the webinar.
Perfect. Okay, guys, so thank you so much again for coming to the webinar tonight. I know there's lots of things you could be doing, but I hope to make this an enjoyable, informative, and educational experience for you. I'm not one of those people who will pretend to know something. If there is a question that I do not know, I will actually say that and we will get the information. What my plan is, because it's a really packed webinar, is that I will literally also send out at the end kind of like a recap, answering those questions in an email also in case we miss any of those questions. So I am the founder of All Beauty Global, and I named it after my daughters and myself, Allie, Laura, Lily. And so it really, kind of started off as a little small dream, and maybe I would develop some skincare products, and then it kind of exceeded my expectations. I got the opportunity to really go abroad and teach a glass skin course in South Korea, and there I met some chemists, some physicians, some really innovative people. And not only was I able to develop my first product, the All Beauty Global PDRN, which I'm very proud of, but I actually have a lot more products that will be launching as well. So the PDRN is amazing. I want to really deep dive into it tonight so you guys can really get an understanding of the whys and really what makes it different and unique. And then I also am the exclusive distributor of Axo Bio Skin Boosters. So there are other skin boosters in the line as well. So next slide. Okay, guys, so what are skin boosters? So skin boosters really are the actual mesoceutical products that really help to enhance the appearance of the skin. So we can rejuvenate collagen, we can give hydration to the skin, we can really transform the skin with a skin booster, whether that's utilizing it through mesotherapy, whether that's using it through a micron jet where we're just barely going under the skin, whether that's injecting it sub-Q. We really are using these skin boosters to make a change in the appearance of the skin inside out. Okay, next slide. And so these are just some, slides showing the differences in really what we offer and what, we can do with what I call bioregenerative, experiences for people. You don't have to necessarily go under the knife to get these really healthy, radiant, exceptional, restoring hydration and glow. You can really use these boosters in combination with other in-office procedures. Next slide. And the thing about skin boosters that I really like is the fact that you can be all different types of skin ethnicities and tones. So you can be as white as myself or as dark as the couple of the ladies on the pictures here, and you are going to have exceptional results. So we don't have to worry about different Fitzpatrick types when we're utilizing these skin boosters because they really are good for everyone. Next slide. Okay, so let's talk about the PDRN. So like Chris said, this is my baby. This is the product that I'm really proud of. This product is something that I will put against any other PDRN out there. When you purchase the PDRN, you will get a box of 10 vials, 5 ml. So a lot of times people will ask me, is it one vial per patient? No. The great thing about our PDRN, and I did this on purpose when we came to the market, we're like a little baby, right? We're not the giant like Regeron, but we have great value and we have great efficacy in the product. So that being said, I really want to take a little deep dive. And if somebody doesn't mind to mute, I would really greatly appreciate it. But I want to take a little bit of a deep dive into the PDRN. What is different between ours and someone else's? There are great other brands in the market for PDRN, right? But what makes ours so amazing is the price per value. So you get 10 vials of 5 mLs in our box of PDRN for $450. You are not ever going to find this type of quality PDRN product at this value. So we came into the market a little bit underpriced per se, just because we wanted to prove that we are just as efficacious and deliver the same results as the bigger known brand names out there. So our PDRN is 2%. If anybody wants to know or ask, we do have a proprietary ingredient that I will not speak of that makes our PDRN really amazing. It is combined with salmon DNA, obviously. Also, the copper tripeptide. So the copper tripeptide is really good for collagen stimulus. It's really good for wound healing, and it's a really good peptide ingredient. Also, we have glutathione in our product. So glutathione is the master antioxidant, and that master antioxidant is good for brightening and lightening in the skin. So you're going to get that natural brightening effect from this actual product. I like to say that our PDRN, out of every skin booster that we're going to talk about tonight, is like the Cadillac or Rolls Royce of skin boosters. Okay. Another product or another really great ingredient that we have in our product is the sodium hyaluronate, and that is a smaller molecular weight that really absorbs really well into the skin. So when the molecular weight is smaller, you're going to get that uptake and you're going to get the benefits of it more than you would if that molecule was higher. So really, really good for the skin. Also, we have another ingredient that a lot of people really just aren't aware of. It's a root extract, and the root extract actually volumizes the skin. So this is a really good ingredient in our product as well. I want you guys to understand, a lot of people ask me about PDRN versus other products on the market and why we would choose PDRN versus, let's say, let's just talk about Skin Vive, right? That's another known skin booster. I always tell people with PDRN, it is your powerhouse. If you are utilizing it as a sub-Q injection, off-label use, if you are using it for mesotherapy or with microneedling, cold plasma, whatever combination you're utilizing it with, you are going to get bioregenerative transformative results, where with some of the other boosters, you sometimes are going to have several and subsequent treatments, to get results. I can promise you, no matter how you use the booster, unless you're just taking it out and rubbing it on with your fingers, you are going to get really great results with our product. And the results are not only going to be able to be seen by you and your patient, but eventually with subsequent treatments, other people will see the difference in their skin. People will ask them what they're doing that's different. Okay. So next slide.
And just a little bit more on the value of the product, right? 10 5
Thank
ml
you.
vials. So what we've found is that does anywhere from roughly like 25 to 33 treatments per box. So on the market that's out there, if you break that down, it's around $9 per ml for the product. To give you a cost comparison, like Regeron, Vamp, or some of the other brands that are out there, they're anywhere from like 30 to upwards of close to $100 per ml. So when we talk about value, this is truly not only just a great product, but it also offers profitability opportunity for your clinic as well.
And there is a question that I see somebody ask, how many treatments per vial? And that's really dependent upon how you use the vial, right? So if you're doing microneedling, literally with microneedling, you are going to probably be able to get 5 patients out of that one vial, depending upon, again, how much you're using. If the skin is dry, sometimes when the skin is drier, it really, soaks in the product quicker. So I usually use about 1.5 mLs if I'm microneedling. I may use up to 2 mLs if I'm using Micron Jet or other techniques. Now, if somebody is doing mesotherapy or if they're doing sub-Q injection, then they may use 1/2 to 3/4 of the vial, depending upon if they're doing full face and neck treatment. Okay. Thank you for that, Chris. Okay, so the next product we're going to talk about is our glass skin product. And this is probably the #1 question that I get about PDRN versus glass skin and when to use it, right? So first, let me talk about really what glass skin is, and then let me segue back to kind of what I just said. So glass skin, think of it as that Skin Vive product, right? Where you've got a product that has a lot of HA in it. You really want to get that hydration into the skin. You really have that client that has dry skin and you're trying to achieve a glow. Great question. Don't let me forget to answer that, Susan. You're really trying to achieve this glow into the skin. I always tell people PDRN is that transformative, get in there, do the work, make that skin completely transform. But glass skin is your radiance product. If you have somebody going for a black tie event or a wedding or whatever, glass skin is a great choice because it's going to provide that really good, beautiful glow. It has epidermal growth factors. It has 15 peptides. It has 17 amino acids and lots of vitamins and minerals. So this product, again, a wonderful product. And yes, to answer the question, it can be paired with the PDRN, but I don't recommend that you pair it with the PDRN at the same time. This is the protocol that I use when I use glass skin. So let's just take, for example, I'm going to do a microneedling package. I'm going to sell a package of 3 to the customer, but in their intervals. So I'm going to see them for 3 treatments every 4 weeks with microneedling and PDRN, right? In that 2-week off period, that 2-week cycle where they're not coming in for the PDRN microneedling treatment, that's when I bring them in and I have them do glass skin. And that just gives them that radiance, that glow, and it just enhances the long-term benefits that they are receiving from the microneedling and the PDRN combination. Now, again, this would be something that you could, layer if you wanted to. You could layer it with an HA product. And if somebody doesn't mind to please mute, that would be lovely. I'm sorry, we're not able to mute everybody, and I apologize for that. So definitely you can layer it. You can layer it with an HA product, with obviously the glass skin. You could even utilize this product in combination with another product that we're getting ready to talk about called Brightening Booster. But just think of this as your hydration, glow, radiance booster. Somebody in the practice who comes in all the time, maybe they're your client that you see so frequent and they have such great skin. You're like, oh my gosh, what do I do on them? Because literally, they literally have great skin already. This is a great booster for them. And I think there was a question, what was it, Chris? Do you see that question? I wanted to answer that just came up.
Can you layer it with HA?
Yes. Okay. You can layer it with HA. But somebody said, oh, how do you apply it in the 2-week off period? Okay. So what I recommend and what I would say to do, non-microneedle it in, but you can use it with any other type of like cold plasma. You can use it sub-Q, injectable. You can use the micron jet. You can utilize maybe nano needling instead of actual microneedling, where you're using almost like an infusion type method to drive the product down, ionophoresis, all of those things. Okay, next slide. Okay, so brightening booster. This is one of my favorite boosters, and I think it's underutilized, and possibly because, I need to do a better job of kind of, explaining why this booster is so great. So, whether it's myself, Fitzpatrick 2, a lot of people would argue which one, but I have a propensity to pigment very, very easy. And then I have my daughter who is biracial. She has the propensity to pigment and has PIH. So with somebody like that, literally utilizing this product in combination with the PDRN, especially like our melasma patients or our prone to PIH patients, this is such a good skin booster to use. It has tranexamic acid in it. It has glutathione in it. In case anybody wants to know, it's 2.5% tranexamic acid. So this is a wonderful, wonderful brightening agent, and you can use it in conjunction with your type, your melasma type or PIH type clients with the PDRN. But again, a lot of times will utilize this in that 2-week off interval between their next microneedling treatments with their PDRN. Next slide. Okay, so this is our Erica Collagen Booster. And this is a product that I implore everyone to really, really listen close about. Because when I first took on this product, it sat on my shelf for a while and I was like, I probably won't use it, right? But it is now one of my #1 used products of skin boosters next to PDRN. So this product is very, very unique. This product literally has a 3D enmeshment to it. So this is polycaprolactone, not PLLA, not Sculptra, but Sculpture. Okay, so this is a softer product. It actually has a great spread. It can spread from a dime to a nickel size. It's great for volumizing the skin. It's great for natural look. So you're not going to utilize this product and it's going to give you that instant fill. And it just is like, from a grape, you're from a raisin to a grape. This is going to build over a period of time. So it looks more natural. It's softer. And we do have protocols for different areas of the face upon request that we can give you, but this product is absolutely wonderful. It's great for under the eyes. I'm going to demonstrate with you tonight when I do the demo a little bit about what I call my collagen eye booster treatment. Okay, next slide. So this product is very similar to Kybella. So this ultra firming essence can be used not just to really reduce that circumference in the face and the, chin area kind of to debulk, but this product also can be used in the axilla area, the hips, the abdominal area, the thighs. And again, we do have protocols that we can get you that give you some instructions on how to inject and where to inject and etc. if this is something that you're interested in. But this product is very similar to Kybella without the negative side effects. And I can also assure you that the thing with Kybella is there are unpredictable outcomes and results. And that's tough because it's a very expensive product. This product gives results, and you're not going to do the treatment and wonder if it's going to work on someone. You will have that debulking and you will have that firming back in the skin. So a wonderful combination product and a wonderful standalone product as well. Next slide. So this product is a wonderful product too. And I want to talk about this product with microneedling because a lot of people wonder what they're supposed to use post-care for microneedling and skin boosters. This product and another product that we're going to talk about in just a minute is the product that I would use for post-care. This is our Erica Stem Cell Daily Cream. And this is a wonderful product. We were trying to find it, but I could not find it to put up here. But this product actually, Chris, my co-partner on the Zoom tonight, his father-in-law or father, I'm not sure which, had skin cancer removed. And the cut was very large on his face. You cannot even tell where the cut even was. And if you could have seen the stitching in his before picture versus after, it's unbelievable. So this product is an amazing product. It has sodium DNA in it. It has centella extract in it. And we have 50,000 parts per million human stem cell media. So this is a wonderful post-care product for any treatment that is CO2, microneedling, et cetera, et cetera. It's a wonderful, wonderful product. So what I do in my own practice is I will utilize this product and a box of the Erica mask, which is our next slide, as the post-care treatment plan for after microneedling, for after laser treatments, and all of those things. And yes, this is a take-home product, Debbie, absolutely. Next slide. So this slide is one of those products that is probably, if I had to say, and trust me, I have used a lot of masks, is one of my favorite masks out there. This also has the human stem cell media. It is absolutely a game changer. Whether you're an injector, whether you're a physician injector, nurse injector, whether you're an esthetician on tonight, whatever you're utilizing in your practice, whether it's microneedling, whether it's injectables, laser therapies, if you want somebody to experience a wow result and a reduction in inflammation and a wound healing response that's almost immediately, the adipose, Yvonne. This product, this mask is your go-to. Hardly anyone leaves my clinic without this mask if they've had any type of procedure that is going to create inflammation in the skin. The HA is amazing. It has amino acids. It is one of those products unlike anything else out there. And one of the guests tonight asked where it was derived from, the human stem cell media, and it is adipose tissue, just so everyone knows. Yes, Vicky, this can absolutely be a perfect post-care pairing after IPL. Also, I will tell you, we work closely with a laser company and they have a CO2 laser and they buy this mask by the boxes, like multiple boxes at a time, because this is such a great product post CO2. I have been told that it reduces their CO2 healing and their severe downtime by almost 7 days. So again, my post care, a box of mask and the stem cell cream. And I have them use a box of mask for the 5 days post their regenerative procedure. Okay. Next slide. So
And each box of the masks comes with 5 individual masks. So it's really easy to just grab that off the shelf. That's your post-care kit. They could take that home and then they just utilize one individual mask out of the box each day.
And if you guys could just remember to mute, I'm sorry that we can't mute everybody. We've had to do the webinar just a little bit different tonight, so I apologize because I need my phone to be able to do the demo. So I apologize, guys. So I am going to demonstrate in just a little bit some procedures tonight, and I am using the JuvPen microneedling pen. It's a wonderful pen. It is probably the best value on the market for microneedling pens. The precision is incredible. If you're looking for a really, really good pen with precision and great value to add to your portfolio of your offerings or have an extra pen in your practice, this is a wonderful pen, and I'm going to demonstrate that tonight. Next slide. And so just to recap, the boosters that we talked about tonight, we have the Axoglass Skin. Think of that as your radiance and your hydration booster. We have the brightening booster. Think about that booster as your PIH partner, your pigment lightener, your melasma bestie. That is your pigment go-to booster. And then we've got the Erica Collagen Booster. The Erica Collagen Booster is going to give that nice, soft volume that's going to build over time. And it is going to give you that natural result, and you will have greater long-term effects from this product also because of the 3D enmeshment technology that Sculpture has. We also talked tonight about the Erica Ultra Firming product. This product is our debulking product. This product is going to really, really help to take down that, heaviness in the jawline and the face, axilla area, different areas of the body where we want to reduce that bulking. Also, it will help to firm the skin. And then we have our Cadillac product, our All Beauty Global PDRN product. This product is the Rolls-Royce Cadillac Skin Booster. This product is going to be your bioregenerative product that's going to give you the most stimulus, the most repair. This is going to give every practice the biggest bang for their buck, and the client results are going to be superior in texture, pore minimization, redness reduction, that transformative look. If you've got a patient who can't maybe do different combination therapies, maybe they need IPL and they need microneedling and they need some filler, start with microneedling and PDRN, or PDRN with, off-label injection. This product is going to give you the results and make your customer and your client a believer in your abilities and what you have promoted to them to have. So they will come back in return and want to do other rejuvenative procedures. And then we have our Erica stem cell mask, and we have our stem cell cream. And again, I'm going to demonstrate tonight with the JuvPen. Next slide. Oh, somebody asked, does that say micro stamping, Chris?
Could we go back to slide actually? Because we got a question about the
Yeah.
pricing and how to price these treatments within,
Okay.
a clinic with microneedling or, something like that. So maybe if you could go through kind of each product and say like what you see from a demographic sound. Obviously that could differ from California, New York to, Ohio or something like that. Like it's going to be different pricing scenarios based on those, but that would help.
Absolutely. So this is what I tell everyone. Again, the demographic of areas, it's going to be different for sure. However, whatever your normal charge is for microneedling, let's say it's $300 per treatment. I'm just averaging, okay? You can charge anywhere from $150 to $300, depending upon where you are, for the addition per treatment with the PDRN. Now, some clinics will charge $600 just for PDRN with sub-Q injections or mesotherapy, anywhere from $300 to $600. So again, when you're doing microneedling, you can guesstimate anywhere from $150 to $300 plus, depending upon where you are. In New York, you're going to see it, way more than that. But, I am from the Midwest, and that's pretty much the average price. As far as the other skin boosters like Axo Glass Skin and Brightening, I charge about $250 if they're standalone. Now, if I am alternating with the actual microneedling in their treatments, then I may give them a break and I may charge $150 when they're coming in for that 2-week interval. But again, this just kind of gives you a little bit of a starting point. And remember, every location is different, and you want to really also, I always tell people this, literally call around other places. You don't ever want to undercut yourself. You want to be right in that sweet spot in the areas that you're doing these treatments based upon what others are charging as well. Did I get those, Chris?
Yeah, we had another quick question. It was asking, can we microneedle / post resurfacing laser with brightening booster? What would be your recommendation maybe for that?
Say that again.
Can we microneedle post resurfacing laser with the brightening booster? I believe is the question.
I mean, like if you're doing like 1540 or something like that, I mean, literally, yes, you can. I would be very gentle if you're going to do a stamping mechanism, because you had the laser treatment, but then you're recreating that inflammation. I would almost, after a laser treatment, not even do the stamping, because they have that uptake and absorption going on already. I don't necessarily think you need to stamp. Maybe just lay it on the skin would be the better choice if it was post a laser treatment.
Or utilize the mask would be like an amazing opportunity post any
Yeah.
like laser treatment as well.
But yeah,
Outside of
I
that,
mean, any type of treatment, guys, I'm telling you, let's just say you have a client who you know is a bruiser. You know you're an injector, you know they're going to bruise, you know this client is going to have little marks. That's just the propensity that they have to, have this post-treatment. If you utilize this mask, you will not believe it. I can utilize this mask, whether it's RF microneedling or it's regular microneedling or it's micron jet, it's, whatever I've chosen to do. And I promise you, sometimes in combination with light therapy, the client walks out and they have this radiant glow. And you think, oh my gosh, they don't look like they had any type of aggressive procedure. Now, CO2 is a different story. But even with CO2, post CO2, the mask is your best friend, and it also is your client's perfect pairing for take home.
we have another question. We get to ask this a lot. Is it best to use the PDRN as your glide or mix it with HA or just apply it after? So if you could address that one.
Yes, so I get asked this question a lot. And again, I am not the say all be all end all, but I will say this. I don't like to use the PDRN as my glide because I like to have the skin open first, and that's just a preference. So most of the time, what I recommend is using an HA first and then using the actual PDRN after that.
Okay.
Okay, next slide, Chris. Okay, so we have some new launches coming, and I wanted to be able to share this with you guys tonight because we've been working on things for a very long time in the background. When I started the formulations of everything, it wasn't the day that it launched, right? This has been going on for quite a while in the background. And so we are at the point and at the stage now that we're getting ready to launch some new, great, amazing PDRN products. And we're going to have a full line. So we are going to have PDRN and exosome Riedel shots. And if you don't know what that is, think about the Riedel as a point of entry into the skin to make the skin almost spongy to absorb what we're delivering. So we're going to utilize those spicules to really absorb the PDRN and exosomes. So that will be a 3 times a week, or depending upon skin type, a nightly treatment for someone. We're getting ready to launch a PDRN, All Beauty Global PDRN serum and cream. And we are going to also launch a PDRN eye booster and a mask. And the mask is going to be so different and different technology than you've seen currently out of Korea. So that's going to be an exciting one. Also, we are going to launch something called the All Beauty Facial on the Glow. Facial on the Glow. So this product is going to be a product that a person could buy. Say they're traveling all the time and they're not at their home base and they want to have amazing skin all of the time on the go. So now we're going to have the All Beauty on the Glow facial that they can take with them, and it's going to have a special stamping technology that will go with it to penetrate the product in. That will be a different kind of product that will not compete with the product that you're utilizing in the office. And then I have peels that are launching. And then also we have re-engineered a device that is going to be Hydrafacial's competitor called Aquaglow, where we are going to be utilizing PDRN, and other skin booster serums to really transform the skin. And last but not least, we launched recently something called JuvSonic. So if you are a sales rep on this call tonight and you're wondering what in the world you can do to get these skin boosters in the hands of estheticians who cannot inject, JuvSonic is your best friend for them. This JuvSonic will penetrate the skin boosters into the skin, and that way the esthetician can now be delivering these skin boosters. Next slide. Okay, so before I go into the demos, I want to let everyone know if you are a part of this webinar tonight, obviously all of you that are on, if you place an order and you go back to the person that sent you to this webinar tonight, you will receive, as long as you place an order of $450 or more, you will receive a free box of the Erica stem cell mask. Okay? Okay, so now what we're gonna do is we're gonna go in to do the demo. Do we only have 20 minutes left?
Yes.
Okay, because I know we're out of time. So, guys, bear with me. I'm gonna grab my phone and we're going to walk into the clinic room and I'm going to set up for the demo. What? Go ahead and mute it.
Biscuit. Why are you on the floor, baby? You okay? Such a sensitive soul, little baby. I love you, little biscuits.
Okay, guys, if somebody can remember to mute, that would be lovely.
我去爸爸那里拿了一些orange chicken，还有那个什么 beef broccoli。Okay.
Can you please mute?
Chris, what do you see? Do you see her or?
Yeah, I could see. What I would probably do is close out the presentation so that way you're bigger on the screen.
But do you see Carol, the patient?
Yeah.
Okay.
I have to go get Kate and then we have to try on an outfit. Where are you?
Okay, guys, I'm sorry. If you can please mute, I apologize. Okay. Okay, can you see Carol really good?
It's super small on the screen. I don't know if there's a way to like make your screen
Ashley?
as the share.
So, Carol, our patient, take a guess. In fact, if somebody can actually guess her age, I will send you an additional box of Erica stem cell mask. You have to watch the chat, Lily.
Some people are asking if you could turn the phone horizontally, if that would allow for the screen size to be bigger.
Let me see now.
What does it look like now, Chris?
She looks upside down.
I think this is the only way.
Why don't you just zoom in on his face? Can we do that?
I don't know.
Can you guys, what do you guys see?
It's just so small. Yeah, are you able to share your screen from the phone?
What are we gonna eat tonight?
Sorry.
Okay.
What?
Not that we can. It's a different.
The yellow.
Vicky, can you please mute?
What are you doing? What are you being sad? What are you being sad? Your daddy's coming home.
I cannot see an option to do that, Chris. No, I need a new one of these. Okay.
I guess people are saying that they can see her fine, so I guess just go for it.
Okay, perfect. We can get maybe.
Somebody's. She looks.
Oh,
great.
did that work?
Same. You're good though. Go ahead. I think that people can see her. Okay.
Yeah, that actually was better that last time.
Yeah.
So I just applied. So what I did first is I did, we numbed her obviously, and then we used a hydrochloric acid spray just to kind of sterilize the skin a little bit. And now we're using a little bit of HA just for the slip. Carol, tell them how old you are.
65.
65. You can see. Okay. So I'm going to shorten this, guys, because most everybody knows how to microneedle, and I'm not trying to show you how to microneedle, but I really want to open up the skin a little bit because I want to prepare the skin to receive the booster. And I used HA for my slip. And Carol has, this is her actual third treatment, microneedling treatment in this series with PDRN. And we also did exosome therapy in the beginning as well. And I am at a 1.0 depth, in case anybody wonders. And I am also at a level setting of 3. And I am just trying to make the skin a little bit pink. See where I'm getting some mild pinpoint bleeding. And that's where I then like to go in and apply the booster. So I will finish her treatment fully in just a little bit, but I want to really focus on this area for time's sake. I need the, so we're grabbing the PDRN in the refrigerator. So I want to address this. When utilizing PDRN, once the actual product vial is punctured, it is good for 30 days as long as it's refrigerated. This is the PDRN.
Hey, Laura, we got asked if you can use LED with the boosters.
Yes, for sure. The LED with the Erica stem cell mask after the boosters, amazing.
And then people were asking how many needles is the cartridge that you're utilizing?
12. 12. So everybody does microneedling different, right? I say there is infusion microneedling, there is regenerative microneedling, there is almost what I call ablative microneedling. Those things, each one of those are different forms of microneedling. You know, I have an account in Florida, and she only does true ablative microneedling. And I mean, they look like a real bloody mess everywhere afterwards. And they have great outcomes. You're not always going to do such ablative type microneedling when you're doing skin boosters. Your goal for skin boosters is really to infuse and really to give that skin what it needs. And the microneedling is what's going to give the transformative effect in combination with the PDRN, okay? So I've applied the skin booster, PDRN. Now what I'm gonna do is I'm going to use the Erica collagen, and I am going to dilute it, okay? The Erica collagen is not a product that needs to be diluted. It does not. However, I am going to dilute it. So I am going to pull out 3 mLs of the Axo Glass skin, and I am going to put it into the vial of the Erica booster. I don't know if you guys can see how. Yeah, right there. So this is what can you guys see this? This is what the Erica booster looks like. And again, it does not have to be diluted at all.
There you go. First in there.
And I am going to, can you see this? Put in the glass skin. Woo! Sorry, guys. Okay, so I'm going to just mix it together, okay? Can you guys see? I'm going to mix it together, and I'm going to pull out about 0.5. Maybe a little less.
One of the questions was, should the vial be punctured or pop the top off?
So the vial should actually be punctured like that, because if you take the top off, because you can take that little seal, like they have the little seal and you can take them all the way off. But if you do that, it's exposing, that cap is exposing it to air. So I like to just puncture. Okay, I don't know if you guys have noticed, but remember her skin, the inflammation came up from the controlled injury of the microneedling, and she had that pinpoint bleeding. And then now look at her skin just from utilizing the PDRN. It's definitely decreased, okay? So now what I'm gonna do is I'm gonna take the collagen booster, I'm gonna put it in areas that I want. I'm gonna do one little massage of it into the eye area, and then I'm gonna stamp with my microneedling pen. So I'm gonna do a stamping technique as opposed to doing circles or what I call cross hatching. Go ahead. I'm gonna reduce my setting, okay? So I'm gonna reduce it down to a setting 1, and I'm going to reduce my needle depth down to 0.5.
Laura, and to confirm, you're using the JuvPen, right?
I am, yes, guys. Now, if you are an injector, you could absolutely inject this under the eye if you want to use micron jet technology, which is not a needle, but really helps to do the little bleps, or what I call, if you've ever gotten a TB test, you get the little pea-sized nodule, and that's what mesotherapy is. You can literally utilize the collagen booster that way as well. So again, I just stamp that product into the skin. I'm going to do the same over here. And this is such a popular treatment because where do women see aging first? Under their eyes, right? Doing okay, Carol? What was another question?
What is the max depth for boosters, or are they just superficial?
4 millimeters for boosters. I mean, Carol has been my client for a very long time. She's amazing skin. I can't give myself all the credit, you guys, because she has great genetics, but you've got people who have these 11 lines. This is really good for that. People who have this little nasal labial folds, the collagen booster is wonderful for. Go ahead and get the mask ready, guys. Right here. Mm-hmm. And remember, this has that 3D enmeshment technology. So this product, if you inject it or you're microneedling, it's going to have a spread and it's going to create that 3D effect under the skin, but still look very natural in the volumization of this product. Okay, so this is the Erica stem cell mask. This feels so cooling and nice, and it forms so well. Now, I want to demonstrate something. After you apply this, you can see that there's plenty of product everywhere. It's a very, very great, highly saturated mask full of product, okay? But what I like to do is I have these little disposable containers. Can you guys see this? Mm-hmm. Okay. So there is a lot of extra product down in this mask. So what I do is I fold it over and then I pour it, I really push it out and I pour it in this disposable container and I mix it with stem cells and growth factors that I have in the clinic, and I give this to them and I have them continue applying what's left of this packet with the mixture of product that I give them throughout the rest of the day. Okay. Then I send them home with the Erica stem cell cream, and I send them home with a box of masks, and I have them use one mask each night for 5 days. And I have them, of course, use the stem cell cream twice a day. Okay, guys, any questions that I can answer for you? Give them to me now. I don't know how long it's going to click off, but I want to be able to answer any questions that I can. And I can't see them, so somebody will have to tell me, Chris, if there's a question.
And we had questions just about like the recording. Can you send out a protocol for this treatment with the mLs and the products? So I think we could definitely put something together that we could get out to everyone that's attending.
Yes, so what we'll do, and I cannot promise it will be until Monday because of this reason. I literally am leaving after this to drive to Scale in Nashville, and I will be presenting there at the dermatology conference. So when I come back on Monday, I'll be happy to basically put a little bit of a synopsis together about the presentation. I'll try to go through the chat, kind of re-answer some of those questions, and then I will put together some protocol sheets that will be sent out in an email. How does that sound, everyone?
Good. Do you charge your clients for the box of masks you send them home with?
Oh, yes. So they do go home with a post-procedure kit. The only thing that I don't charge them for is the little, disposable vial, like a little container that I make. But yes, I call it the post-procedure package. And, whether it's an injectable person or whether it's, a laser person or whatever, that client does pay for their home care.
Is the PDRN
Or you can build it into their packages of PDRN, brightening, exosomes, et cetera. And that's something I want to touch on really quickly. So Carol, obviously beautiful patient, but just like myself, we all have these issues we struggle with. And so I have used brightening on her. We do microneedling on her twice a year. So she's had all the things, but exosomes, PDRN, brightening, glass skin. Brightening is just that go-to product for anyone who has the propensity to pigment.
Can you touch on the shelf life of the product and then expiration date once it's punctured?
Yes, so shelf life of PDRN, if it's not punctured, is 3 years. Other boosters, 1 year. If it is punctured, it's only good for 30 days. Every product needs to be refrigerated after puncture, with the exception of the actual collagen booster.
Then is PDRN affected by hot post-laser skin? Will it degrade the product?
So no, it's not going to degrade the product. But I did have a rep of mine ask me this question recently. They live in Arizona, and deliveries, could of the PDRN or the products, if the product is sitting in the sun for long periods of time, I would think that could at some point, if it was out there for like 2 days straight, in the 115-degree heat, that could maybe mess with the actual product. And again, I don't know that this is true or false, but I wouldn't want to just leave a product out in the heat and the sun that's supposed to be at, regular room temperature kind of a thing. But to answer your question, Chris, usually post-ablative procedures like CO2, lasers such as that, you're going to use more exosome therapy. But PDRN has such a high ratio of wound healing that it would be good to utilize, and you're not going to have to worry about if the skin is too hot and it's heating up the PDRN and demeaning the effectiveness of it, because it's not going to be like you have, it on the oven or anything like that. But that's a very, very good question.
One last thing I wanted to touch on, pricing of the products. So the PDRN is the highest one at $450. So you can see that the value of the other products are great as well. So these are affordable. We wanted to make them affordable to clinics and to be able to utilize for their patients throughout. So just to give you an idea, like literally the PDRN is $450 a box for the 10 5 ml vials. The other products that have been highlighted today are even less, less cost than that as well. So.
And I'm taking this mask off. Normally I would let the mask on for about 10 to 20 minutes, depending upon my patient's schedule, et cetera, et cetera. But because of time's sake, and we're ending, the actual webinar, I wanted to just take it off and show you. So I always will massage the rest of this into the skin. But look at her skin. Look how it calmed the skin and it took down the inflammation. You can't see the areas where I was really going in and stamping. It just looks like a nice, flushed, healthy pink glow that you get after the microneedling treatment. And then, of course, I'm going to put a stem cell cream on and send her on her way, because there's not any need to put sunscreen on. Okay, before we conclude, questions? And this is the stem cell cream, guys. Can you see it? Okay, well, don't forget, you have until midnight to place an order to receive your free box of the Erica stem cell mask. If you have any questions.
I had a question. Can I ask it really quick?
Yes, who is this?
It's Melissa. How are you?
Hey, Melissa.
With the CO2 lift mask that can also be used after microneedling, can you still put that on or put it on that evening to help speed up recovery once you use either the booster or the PDRN?
Yes, 100%.
Is there a preference you like? Do you like it more like an hour before they go to bed, or do you like them to leave would you want them to leave with it on? Does it really make a difference?
I say about an hour before bed is the best.
Okay, perfect. Thank you.
Absolutely. Any other questions?
Are you going to send this out? This Melissa again, sorry. Are you going to send this video out that we can share it with our accounts that weren't able to make it on the call?
So what we might do, this is not my area of expertise, and my marketing girl is here, so she's probably like, oh no, when I say this, but I'm going to try to watch it back. Take out the parts where maybe, people were not muted and things. We're going to try to splice this up and use it for content, use it for educational tools. And I will be doing a more consistent education type things like this, where, we're going to do a webinar that's just geared for your prospects, a webinar that may be geared more for sales reps because they need training in XYZ or whatever. So we're going to be doing some things like this. Like I said, we're still small, but we had 600% growth last month. So I really wanted to come into the market and establish a little bit of a footprint, really allow people to see how amazing the products were, and then lead into that with greater marketing and more webinars and tools that people can utilize, not just as sales reps, but people that are actual in the clinics doing these treatments, where we can support them with marketing materials in the form of these little educational type tools. So in like loop videos and things like that.
Where do we go to order?
So you need to get back to the person that invited you to this webinar. So if that was me, then you get back to me. If it was our sales rep that invited you, get back to them. If it was Chris, who is my sub distributor, go directly to him. But there are a lot of different people from a lot of different places on the webinar. So we ask that you be super respectful about, going back to the person who invited you to this webinar. And we thank you so much for taking the time to hang in there with us through all the little hiccups and the ups and downs. So I really, really appreciate it.
Thank
Thank
you.
Laura. Thank you guys for attending. Really appreciate you coming on.
Thank you.
Thank you so much. Great time.
Thank you.
How'd that go, guys?